Good morning. Happy Sunday to all of you. Today I'm really excited to announce that we've started a new strengthening program, and I'm just going to wait here for Jan to join in and give everybody a chance to... Hi. Hi, Rhonda. Hi, Jan. Yay. Hi, Jan. Let's just wait a few minutes. But so what we've done is in the past 16 years of just treating TFCC tears, we've noticed that there's a need for a strengthening program. Probably the biggest complaint that we get from people with TFCC tears, fortunately, is that the strengthening program that they're doing makes things worse. And so this is a way to address those concerns. It's taken a long time because we wanted to articulate a program that did not flare or re-injure the TFCC. It's a progressive program. It's something that you can do online, anywhere from your home, and it's monitored. So we watch you closely. Jan evaluates your wrist, gets you started on a simple program, and then progresses accordingly. It's a pretty nice program. I'm really happy to announce it. Jan, you want to jump on in? Let me introduce you. Okay, Jan, you should be coming in a minute.
Hi, Wendy. Can you hear me well?
Hi, Jan. Yes.
Thanks
It's it.
for inviting me onto the Instagram Live, the weekly Wrist Whisperer show that everybody always sees on a Sunday to join.
In different places, yes. I managed to join consistently at 10 o'clock on Sundays. It's great to have you here. You're in South Africa. I just wanted to introduce you. Jan has been working with me for, I don't know, has it been 8 years, Jan? 7?
It's been quite some time.
Yeah. Jan helps me with research, and he helps coordinate all of the patient care, and he's a rock star in the world of TFCCs. It's really a pleasure to have you here. So tell me a little bit about this program and the details of it, and everybody listening.
Okay, well, as Wendy said, it's been something that's been on our minds for the last couple of years, and in terms of how can we better serve the ulnar-sided wrist pain community, as on a daily and weekly basis, everybody always tries to figure out how can I get back to being active, or how can I reincorporate these things that I love to do, that's been just abruptly stopped because of wrist pain, right? And the big question on our minds is then how can we help in a way that's accessible and that also doesn't flare you up. And that's something that you can consistently do on a daily or weekly basis. So that led to a lot of discovery, a lot of self-experimentation, and trying out different things to see, well, what works and what are some common things that a lot of people can start doing. And that was how the exercise program was born. And currently, the main goal still is just to see how can you effectively start being active, even if it's just by perhaps walking or doing some exercises that might seem really rudimental to someone else. But usually it's these small steps in the program, which is very progressive, that we use to build on to eventually get someone from not being able to play tennis or not enjoying activity they used to do before having ulnar-sided wrist pain, and ultimately to enjoying life again. And I think that's the main goal. In summary is, how can we get you back on track, back being active and enjoying everything you want to do?
Yeah, we started with a couple of test cases, and we've known for a long time that certain things like bicep curls and wrist extension, wrist flexion with weights are common things that flare people up. Also, end range supination exercises like a pull up with the palms twisted, and then of
Yeah.
course push-ups being the last thing. And some of the things we've noticed that are pretty significant is that the extensors of the upper body are really weak, triceps specifically, and the subscapularis muscles of the shoulder blade. How are you addressing those, Jan?
Okay, so in all of those specific muscle fields or strength issues we see, we try to see what is the easiest way that we can start incorporating these movements, right? So with triceps, we know that on the WristWidget YouTube site, it's something that's previously been touched on. So we always start with having the wrist in as a neutral position as possible, and just without any load sometimes, just doing some end range tricep work, and progressively trying to add more range. So over time, we might start adding and using a bottle of water for load, which is very nice about the program, is you don't need a lot of that equipment, right? And especially now where a lot of people need to train at home and stay active at home, anything that you have around the house can be useful. And over time, we progress you to add a bit more range of motion to the movement. Same with the extensors, where initially we try to stay away from loaded wrist extensions that most people usually start on. We don't work in that specific manner. We rather use a combination of isometric work, and over time, as tolerance starts building up again, we start to slowly add in movement.
Yeah. Now, there's a nice way with the program you've designed to monitor people and be available to answer questions and make sure that they're not progressing if they start to flare, and kind of make sure that everybody's doing moving in the right direction. Can you explain some of those?
Yeah, so the software we use is TrueCoach. So what's really nice is anytime that you have a question about an exercise, or you perhaps have a query on something you're not sure about, it's really easy just to record your last couple of reps or sets of a certain exercise and upload the video for review. And then we can take a quick look to see, is there something specifically we can advise you to do that might change the way it feels? Or perhaps you just need some guidance. Sometimes it just helps to have someone have some oversight on what you're doing, just to give you that extra bit of motivation and to guide you through it. We also know that recovery or training isn't a linear process, right? There's always some ebb and flow. And Wendy knows this as well. She's seen this in practice for so many years. And sometimes it's just reassuring to have someone from an outside perspective just assist you where possible and get you back on track.
Yeah, now, one of the things that we've seen a lot in patients with TFCC tears is ulnar nerve pain and radial, superficial branch of the radial nerve. And a lot of this is, I would define as nerve tension. And we have found that this component has actually really slowed people down in their strengthening program. And so at what point are you adding dynamic, full nerve tension load? Is that middle of the program or towards the end of the program?
So that's an interesting question. So obviously, which is always nice, is to have your scale nearby, right? I know Wendy usually on most Sundays talks about the non-digital scale, and it's always a good gauge to use throughout the program to see how are you doing. Is your grip strength still what it was usually? Is your weight bearing still on par? And in terms of adding dynamic movement, anytime we add a more progressed version of an exercise, it should be done at a specific time. So we won't start you off with a full end range position where you're putting the nerve on stretch, where you're loading all of the musculature without prepping you for that point in time, right? That's why we start with a easy position. So we're not stretching the nerve through a large range of motion. We're not adding a lot of load. And as we move along, as you start to feel more confident and as you build some tolerance, then we slowly start. We add some flexion or extension, or we make it a compound movement. So really over time, based on how you feel, and I think that's also important to note, is the program is not set to end on a specific day or date, or if you reach this within 8 weeks, you're good to go. Really, it's all dependent on the time that you can put in and how you respond. I know that the recovery process and the exercise process is very individual, and we can't really put a label on everyone's how they will experience the process. And I think it's very good to keep that in mind. If your process of your recovery isn't the same as the person next to you, that's also okay. It's something we have to work around, and everyone has different anatomy variations as well. So there's all of these things that can play a role. And I think sometimes that can make the process a bit complicated, right? Is why do I still have this, or why can't I do this yet? But I think the better question is, how can I get there? And that's what we're trying to ask. How can we help on this pathway, be it through different variations of exercise, different ways of loading, or perhaps modifying exercises according to your symptoms, right? Because like you mentioned, not everybody has nerve, but some issues.
Yep.
And that can also bring in another variable. And how do we figure out the correct pathway to go?
Yeah, and we also have a wide range of abilities. You know, we have some elite athletes and some that are sedentary, and so it's nice to have a starting point for everybody and a different ending point. I'm really excited about this program, and it's a wonderful service to people with TFCC tears around the world.
Yeah, I think it's good, the different starting points, right? And that's why
Yeah,
we have 3 phases.
yeah,
Almost everybody can start on phase 4.
yeah,
It's always a good idea if you've been cleared for exercise and you know that you're on your rehab route. Phase 0 is something that anyone can start at home. You don't need a
yeah,
lot of specialized equipment. You
yeah,
can use a water bottle, have a small dumbbell, you can use that.
yeah,
Even no weight at all.
yeah,
Moving forward, the phases, obviously, as they progress, we would like to allow you to weight.
yeah.
Right?
And some people can get started with the program even if their wrist stability is not 100%. So you can start the strengthening program at level 0 if your weight bearing tolerance is, we don't recommend strengthening when your weight bearing is below 45 pounds, but between 45 and 65, it's a good time to start strengthening without loading the wrist. And then, of course, once you hit 65, you can do a dynamic and more progressed program. So it's nice for people to get started on it as quickly as they can and get their lives back to normal. Does anybody have any questions? Here we go. All right, you got your grips and your pain. So, Rhonda, I'm just curious what your weight-bearing tolerance is, because that's going to help define quite a bit.
Yeah. And also, we've some therapists out. That's also another thing we can add is if there's any therapist that's interested in chatting, we're always interested in having discussions, right, about how can we better on the side of this thing. And having this about exercise and putting the control back in the person who's experiencing these symptoms' hands. It's always good to have a discussion about that. So, any therapist.
I went to Norwich in the UK to a conference and met with a team of therapists that designed a strengthening program, and it was the first of its kind for people with ulnar-sided wrist pain. I think it was very broad and very general. It was a good step to start, but we'd really like to get all practitioners, hand therapists and doctors to participate in this program, because the more data we have and experience we have putting 3 people through the entire program, I think we'll be able to fine-tune the details. I think we're pretty close, Jan. We've been working on this for a while, so I think we got it going on finally. But we'd love to collaborate with people around the world and clinicians around the world. This, I said, I need help. I've lost range of motion and my wrist is so stiff. So this must not be this is to, let's see here, Rhonda. Your range of motion is usually not an issue with TFCC tears. So I suspect this has got a correlation to either a wrist fracture or maybe a surgery. So comment on that, Rhonda. Oh, I've been hand therapy for 4 months, grip pain bad. Yep. Okay. What does strengthening without load mean? Okay, strengthening, when you take the wrist and you rotate it with supination, with the elbow extended, or with weight bearing, you're loading the wrist. And you're loading the wrist muscles if you grab a 5-pound weight. That's a load. So strengthening without load is doing some really specific exercises at the elbow and the shoulder and the lats and the teres minor and the pec major and the subscapularis without a weight to the wrist or the arm.
Yeah.
Great question. Thank you. Okay, so Again, one of the things that we are focused on at the first 0 phase. So, Jan, can you just describe some of sample exercises that we do at phase 0, the first phase?
Yeah. Okay, that's a good question. So some of the goals we try to achieve is firstly a full wrist range of motion without any external load. So that's without really using like a bottle of water or a dumbbell or any resistance band. And just trying to see, can we move through a normal flexion extension, palm rotation, all in a radial deviation without any load, and also can we do it with a extended elbow or a split elbow. Another thing we try to do is test shoulder strength and flexibility. So do I have the ability to go into shoulder extension, flexion? Can I move my arm in different planes of motion? We really have a couple of nice videos, probably adding more instructional skills on and also what we also try to achieve is a big focus has been turned to biceps and extensions of the forearm. And that's also something we try to train in phase 0 as a good way just to start some load into the wrist, elbow, and shoulder. And that's the primary goal in phase 0 is to introduce some movement to tolerance and to see how we can progress on that. So as we move through phase 0, we'll start to add some load, we'll start to add some range of motion, very slowly according to your pace. And nice. By the end of phase 0, we would like to see you tolerate a lot more things, be able to pick up or be able to do some more things without having these constant
Nice.
Yeah.
Nice. Okay, any other questions for any of you? Let's see.
And I think another good thing to mention is what we're trying to also do is you have a 1-week trial. So anyone that's interested at any time of during the year or would like to see, is there something that would be useful? Always we just want to add value. And if it's something that won't be useful, it's always good to know. So the easiest would be reach out to any other of the team members. Just send us an email, pop a message on the Facebook group, and we can get you started on a 7-day trial, and you can experience some exercises. You can see, perhaps it gives you some ideas on how to incorporate some training and exercise into your regime. And it's just a good way to get at it. And that's our end goal, yeah.
Yeah, now we had to come up with a model, a model to do this, and one of the factors was affordability. And so, what is the program cost?
Yeah, so the program cost is $50 a month. It's not a subscription service, so you can opt in and opt out at any time. If you would between the program, so between phase 0, phase 1, and phase 2. And you can also determine if you feel ready for the next phase. We do have a couple of milestones between all of these, what we would like to see you be able to do. And it also gives you a couple of goals to work towards. Knowing where you would like to be really helps set some expectations and set some useful guidelines in terms of progression. So if you come in at 0, you might feel it's too easy, or you might feel that you're progressing at a fast enough rate. And you can always jump towards phase 1 or phase 2, depending on availability of equipment, your time, and all of these other factors. So it's really a plug-and-play model in terms of where can you join, and if you want to leave after a month or 2, you're also more than welcome to do that. So we're really trying to keep it as modifiable as possible, and have a real ease of use. So it's really user-friendly. We have a tutorial on how the system functions. And it's really easy to get without too much effort from your side as a participant.
Nice. And then how would people sign up for it?
Okay, so the best way to sign up is to do it directly through email. So if you're interested, you can, like I said, either email one of the WristWidget guys or drop me an email at jan@wristwidget.com. And just in the description add it's in regards to the exercise program or wrist ability, and I'll get back to you regards to that, and we can have a bit of a chat and see if this is something that might be useful for you in your journey for reincorporating of the illness side of it.
Nice. Nice.
Yeah.
And so when you start the program, we always recommend that you have a non-digital scale so that you can get some objective numbers of what your weight bearing is. And we also like to get to know you a little bit and figure out what your experience is with your injury and then get you started. So Jan and I will work together, and we'll look forward to seeing you guys all online and getting back to normal. We'd love some pictures of all of you that went through the program and are back doing their normal things. This injury heals beautifully. We have lots and lots of experience of people that are finding complete and normal return to regular activities. So this can get better, and I'm looking forward to sharing more information with you guys next weekend. Is there anything that I missed, Jen?
No, I think you gave a good summary on everything, more or less. I think if there's any other questions, it's always best just to reach out. We love to get in touch with people who need help and who we can assist with on any part of their journey. And we really hope this is something that can be useful to a lot of people and get them to enjoy what they love.
Aww. Hey, Susan, do you want to jump in? Let me see if I can, let's see. Here we go. Oh, yay. Hold on. We got somebody here that started a program with us. She's a great success story. Let's see. Oh, yay.
Oh, hi.
Hi.
Hi, Shannon.
Whoa. Doing some yard work now. My name is Shannon.
Shannon,
and I'm doing the WristWidget program. I've been with them, oh gosh. They are very dedicated to helping me get back to my full capacity. I did a phase before phase 0 with Kelly Aaron, and that was pretty amazing, and it got me ready for the WristWidget program.
Yeah. Shannon is really a dedicated trainee, and that we've really enjoyed working with, and just getting her back to biking and being active. And Shannon really is a trooper in commitment, always ready to do more and to go full out on the program, and it's been really good working with Shannon. And Wendy also know that she's had a long road through this process. And I think, Shannon, where you're at now, it's really good to be able to do all these things, that you enjoy doing.
Yes, I even did probably 3 hours of yard work yesterday that involved a clipper.
Oh, nice.
Yeah.
Clipping shoots. And last year that would have probably put me down for a week. But I'm doing quite good today with pain, minimal. Yeah, it's wonderful. I can bump bike. I haven't tested canoeing. Canoeing would be a really good test, like a week trip of doing this. So that's coming up, I would say.
You had a really bad injury. You had a significant tear and have come a long way.
Yes.
Yeah.
All through this program.
Yeah, nice. Well,
I recommend it. Don't be afraid of telehealth. Telehealth is amazing, especially when you can't see experts that are in your own town. I saw a few hand therapists, and no one ever heard of the WristWidget, so I was very, since they didn't know the protocol, they didn't have any load-bearing distinctions between their programs. I just didn't feel safe starting with a local hand therapist just because they weren't aware of the WristWidget. So don't be afraid of telehealth. This is a wonderful program, and thank you very much, guys.
Aw, thank you.
Thanks for sharing.
Thank you, Shannon.
Okay, I don't know how to exit out. You'll have to kick me out.
I don't know either.
Okay.
Let's see. Okay. Still don't know how. But that's okay.
I think you should
Okay, well,
to exit at the top, Shannon.
You'll do
I
exit
think-
at the top.
okay.
All right, cute. Oh, there we go. So Sarah, I'm getting your messages. It's really important that you get a scale. We can't really help you unless we know where you're at, and there's really no other tool that we have to understand what your stability is. And you don't have to go buy one. You can just go to a store and test it at the store. So if you're out, Sarah, and you go into a pharmacy or a grocery store, see if you can do the test right there at the store, and let us know when you get those results. All right. Well, Jan, appreciate you very much. Aloha from Oahu, and I hope you're going to make your way over here someday soon.
Yeah, I also hope so very soon. Thanks for having me, Wendy, and have a good Sunday.
Bye.
Bye-bye.